Health is a state of complete physical, mental, and social well-being, and not merely the absence of an illness. And as part of bringing the healthcare sector to the fourth industrial revolution era, Homespital app has revolutionized the patient and health practitioner relationship. The app connects people who require specialist medical services with professionals at the easiest and fastest way possible. For more on this conversation, we are now joined by Homespital founder Nkululeko Khumalo. Mr. Khumalo, thank you so much for your time and for joining us this evening. So Homespital is like the Uber of the healthcare services. Tell us about this app. How does it work and what your objectives are with this platform?
Thank you so much, Katlego, and good evening to the viewers at home. So Homespital is a very exciting, a revolutionary and interesting application which essentially looks at getting users and healthcare professionals to meet on one singular platform. It is, as you've said, the Uber of the healthcare sector, which, you know, if you require medical services, from specialist services through to your basic caregiving services, you can access those either in transit or at the comfort of your home.
So does this platform focus on a particular demographic? Are you looking at a more affluent, urbanized patient, or are you looking to cement yourselves within the rural areas?
That's a great question, Katlego. So what we found in our research, because, you know, before developing the platform, we've undergone some extensive research, particularly in South Africa, and we found that there's similar trends being picked up in other countries, which is why Homespital is a .com platform. If you look at the doctor-patient ratio in the developed world, you find that, you know, there's one doctor to about 200 to 300 people. In our, you know, sort of developing as well as underdeveloped countries, you find that those ratios could be 1 is to 2,000 is to 3,000. That number is almost 10x the value. And that actually tells you that, you know, we can not only look at the urbanized only patient, but we're also looking at the rural-based patients as well as the peri-urban patients. So this will be an all-inclusive platform which does not discriminate against any particular demographic.
With that particular demographic, those specifically in the rural areas, how do you demystify those that are looking for the traditional way of going to a doctor, having a physical examination as opposed to one that's happening online?
I think that is quite a challenge. I mean, with change and with technology adoption, there are always challenges. But I think we've seen some very resilient technology, you know, trends and types, penetrating even the most sort of looked down upon, if you like, users. I mean, you look at the M-Pesa, how the M-Pesa has thrived in East Africa. There's many other various examples of even the mobile, you know, device itself. You know, if you look at how it's penetrated the African continent.
Well, it seems as though we have a connection issue. Nkululeko, are you still with us?
I am. I don't know if we've just had load shedding.
You just had load shedding.
I don't know if you can hear me.
Well, yeah. I mean, that's the beauty of stage 6. We can certainly hear you now. But you were saying, of course, there are challenges in moving patients from the traditional way of seeing a doctor to the more technology way of getting a consultation.
Yes, absolutely. And those behaviors will continue. And, you know, we by no means are looking at replacing the traditional hospital. I think what we're looking at doing is enhancing what already happens in hospitals and being able to give access to those who don't have access by doing remote, you know, consultations through the platform, remote diagnosis where you'll be able to to have those preliminary diagnosis done of various things, even in the oncology space. And yes, and therefore we would be driving traffic, into practices of various medical professionals with the platform, and not just looking at replacing, because you can never really replace that physical interaction. But in order to scale and improve on that doctor-patient ratio, we're looking at using the technology to, reach those who are not within reach, especially with incidents that require urgent attention.
Of course. I mean, I went onto the app earlier on and I realized that it gives you the options of signing up either as a patient, a caregiver, or as a practitioner. We know that with e-hailing services, there's been a lot of criminal activities with regards to people who say they are offering a service, but instead are coming in with ulterior motives. How are you mitigating that risk?
Absolutely. I mean, that is a great challenge, which we have, undergone by making sure that we do thorough, verifications of all medical professionals that we onboard onto our system. So prior to being onboarded, from identification, your ID verification, your ID check, to your health professional status in terms of affiliation with various, government bodies, from the caregiver all the way to specialists. We do those kind of verifications, as well as criminal record checks, in order to ensure that we don't have any inappropriate medical providers on our platform.
And could this be a solution not only for the private sector, but possibly extend to collaborations with the public sector in order to alleviate backlogs in their systems?
Absolutely. We see that opportunity, and we anticipate and really look forward to engaging with the public sector on various solutions. I mean, if you look at what our solution will do, once we get to a point where it's matured, we would be able to have, patient record information and, utilization information. So, we can be able to aggregate data that could be useful to various public sector bodies, to analyze things like, DNA-based, because there's a thing called pharmacogenetics, which is a technology and a breakthrough with regards to understanding what people with particular DNAs are prone to in terms of diseases. And that alone, could be able to look at various medical breakthroughs in terms of medication and diseases of all sorts.
I mean, earlier on you made mention that it's a .com platform. Are there any expansions beyond South Africa and Africa and possibly to the rest of the globe?
Yes, certainly. We are planning on expansions beyond South Africa. This is our home and the sort of the bedrock, or where everything is starting. But, we've trademarked the various components of the business in the African continent, as well as Europe and the US, and we're currently busy looking at the different other parts of the Middle East and Asia to trademark the platform. But it is essentially something that we are hoping and anticipating would spread out to various regions. Yeah.
And lastly, Nkululeko, what role do you believe that AI will play, especially across the African continent, when it comes to healthcare services and really just getting services to people on time and services that are impactful and essential?
Well, I think, sure, the possibilities are limitless. I think there are some, sort of
Well, it seems we have lost Nkululeko there at the end of this conversation. That was Homespital founder and director Nkululeko Khumalo speaking to us there about their revolutionary app that links hospitals, caregivers, as well as practitioners to patients that are in need of immediate care.